So what we wanted to do was just pull out a few themes that are common to all of the nationally commissioned services and cover those first, and then we'll go into each of the services in a little bit more detail. So some of the things that are common to every service is your pharmacy team. As pharmacists, you are not alone in delivering these services. As Lovejoy said, it's really important that you involve your team and support the workload for the nationally commissioned services. So your team should be checking farm outcomes regularly, and they should be alerting the pharmacist, including locums, to any referrals that have come in and need action. It shouldn't be the pharmacist's responsibility. You've got an awful lot on your plate as a pharmacist, so use your team to check farm outcomes. You should be checking that at least twice a day, if not more. You should make sure that all your staff have got access to both NHS Mail shared mailbox and farm outcomes, so that they can support you with identifying any referrals that have come in. We're seeing a common theme around locums, particularly using the fact that they're a locum as an excuse not to deliver some of the nationally commissioned services. If your pharmacy is commissioned to deliver a service that's nationally commissioned, then the contractor should be ensuring that locums are delivering those services, particularly those such as DMS and CPCS, where there is a requirement to respond to that referral within a certain amount of time, and where they are very commonly commissioned across Greater Manchester, and obviously DMS being an essential service. So locums should be getting involved and should be delivering these services. And the services that you're commissioned to deliver must be delivered throughout your pharmacy opening hours. Smoking cessation, hypertension, case finding and contraception might be slightly different with respect to locums, but actually there's no reason that a locum can't deliver any of those services. Accepting referrals in farm outcomes is a really good one. As I mentioned earlier, the programme team are looking at the farm outcomes data on a regular basis. They're identifying any referrals that are sitting at referred status, and that means that no action's been taken. So if you've seen a referral and you're doing something with it, you're in the process of contacting the patient to follow up that referral, then please press accept in farm outcomes. That tells us that you've seen the referral, you're doing something with it. It puts it into a pending state. And please remember that everything that you type in farm outcomes is visible to the person who referred that patient. So for smoking cessation service referrals, the cure team at the hospital can see everything that you've entered. GP CPCS referrals, same again. The general practice can see all the data that you've entered. They have access to that through farm outcomes. So anything that you enter into farm outcomes, including your rejection reasons, any clinical notes, any consultation notes, please make sure that they're clear, concise, professional and appropriate. We don't want to see lots of exclamation marks and things in caps lock and unprofessional comments being made, because this data, this information is visible to the referrer. Really important, you've got standard operating procedure in place for all of these services as required in the service specifications separately. And make sure that you're delivering all of your patient-facing consultations, including those that you deliver remotely in your consultation room. Next one that's common for all nationally commissioned services, get your team involved. Make sure that all of your team know which of the services your pharmacy is commissioned to deliver. We've got around about 50% uptake across Greater Manchester of the smoking cessation service. Hypertension case finding, I think we're closer to about 80 or 90% of pharmacies. So make sure that your team know which services you're delivering. Service delivery is not just the pharmacist's responsibility. Identifying a referral is really important. Sometimes you might get a patient presenting in the pharmacy who has been referred, but it's not clear. They don't say the right words to you to understand that there is a referral. You don't want to lose your income for that service by treating that as an over-the-counter query. This is particularly for the CPCS referrals that are going to start coming through from urgent and emergency care. So making sure that your whole team, including those staff who work on the counter, understand which services you deliver and how to identify a patient who might turn up in the pharmacy who is a referral. As I mentioned before, your team should be checking farm outcomes regularly and flagging any referrals that need action to the pharmacist that's on duty, and almost holding that pharmacist to account to make sure that they've completed those referrals within the appropriate timescales. And making sure that your pharmacy is offering and delivering those services throughout the pharmacy's opening hours. Technicians, I'm sure you're all aware of the updates that came through earlier the year in April, May time. So technicians can now directly deliver smoking cessation service and hypertension case finding services, which is fantastic. So that just allows you to spread the load a little bit within your pharmacy. And also technicians can deliver the majority of the discharge medicine service. So if you do have registered pharmacy technicians in your pharmacy, please make sure that you're using them to deliver these services, to take the pressure off the pharmacist. Some other things that are common around all nationally commissioned services is local engagement. Your success or otherwise in delivery of these services is going to be based on the relationships that you have with general practice, hospitals, and other key stakeholders. So engaging with your local practices and PCNs is really key to maximising success. So for GP CPCS, the practice needs to be reassured that you're going to do something with those patients who are referred. They won't keep referring patients to you if you don't pick those referrals up, because what happens is those patients then go back to the practice to complain that you've never followed up the referral. They lose faith in the system and they will stop sending referrals. So you need to pick those referrals up. But it's a two-way process. So do talk to the practice about referrals that they've sent. If there's any escalations that you've made where you felt things could have been managed differently, if you've got any inappropriate referrals in the first place, so maybe you've had a child under the age of 1 referred, which is outside of the service spec. So have a two-way communication channel with the practice around GP CPCS and really make that service work for both of you. With regards to hypertension case finding and contraception, for both of those services, you need to make sure that the practices and PCNs, first of all, are aware that you're providing those services. And also you need to have those local conversations about how referrals are going to work. What's your capacity to receive them? How are they going to refer patients in? How many? So you need to have those local conversations, particularly around hypertension case finding and contraception. With DMS, again, the relationships with your local GP practices are really important. So if you pick up any issues at stage 1 or particularly stage 2, you need to be feeding those back to the practice. So talking to them about DMS and how you can work more closely together to improve the process for the patient is really important, particularly if the first prescription that's issued after discharge is not correct. And for the smoking cessation service, hospital cure teams, again, need to be reassured that you're going to support patients who they've referred on their quit journey up to 12 weeks. They're really open to you as community pharmacy being in touch with them. They want to know who you are. They want to know that you're going to look after their patients. So please get in contact with them, build a relationship with them. They're really good people. Diane and I have spent an awful lot of time with the cure teams across Greater Manchester, and they're incredibly passionate about what they do. If you can't accept referrals for a short period of time because somebody's on holiday or off sick or whatever, tell the cure team they won't send referrals to you for that short period of time, and they will welcome that contact from you, because it means it shows them that you are actively picking up those referrals and doing something with it. So really think about the relationships that you've got in place with all of the different parties who refer into community pharmacy for these services.